Good afternoon, distinguished guests, dear colleagues. It's wonderful to be here today. Thank you for the invitation and thank you for listening to a topic that maybe doesn't immediately seem to fit in with today and tomorrow's conference themes. But I hope by the end of this, you'll be inspired and we have some exciting conversations. So oftentimes climate change is considered, or we're being told that it's extremely technical, maybe even that technology isn't ready, that it's for others to do, not for us in low and middle income countries. And in health seems really strange, right? So we're often kind of given this impression that it's as difficult to do as brain surgery or rocket science. And really, it does often feel like that for those of us who are engaged in it. So climate change is kind of considered as a wicked problem. What is a wicked problem? Well, it's more than just a complicated or complex problem. It's constantly evolving. So there's no good and bad about what we do. It's maybe just better or worse in terms of the decision making. There's multiple stakeholders with gazillion interests. And the changes we make are rippling through the system, right? And so what created the problem is not really good for addressing the problem. And so it's really this kind of information or innovation and transformation that we need in the system to address climate change at large. Most often, we really don't know how to do transformation, and certainly not how to do transformation on climate change. That's why it continues to come up on policy level and even here on institutional level. So what are the elements? How to do it in LMIC? Is technology ready? Is it too expensive? And why should we do it in healthcare when we're actually here to save lives? So I just want to share AKU's story a little bit, the story of the Aga Khan University, of what we've been doing over just the last 3-4 years, actually. It's an evolving story. And we're going to start here to see what we know, right? What you're seeing in the darker red colors are the countries that are more vulnerable to climate change. Incidentally, these are actually many of the countries that the Aga Khan Development Network, so including AKU, are engaged in, right? The countries of Central and South Asia and East Africa in particular. We're extremely vulnerable to the impacts of climate change. Unfortunately, across this university, there's a lot of research, especially on the health impacts of climate change. So we're also being told in these countries that we must adapt, right? The climate change impacts are here. And that's correct, we must adapt. But at the same time, we have other opportunities that we want to look into. We don't just want to play victims, right? And generally, there's also the sense that we're being told, or that it's easier to blame a few, let's say, celebrities with their truly disturbing records of flights on private jets than actually to look at, let alone change our own actions. What we also know, of course, is that climate change affects human health, right? Via the environment, via vector-borne diseases, via direct, heat, etc., pp. Right? And so what is much less known is actually that the provision of healthcare, so our healthcare institutions, such as our own, actually have a really high impact of greenhouse gas emissions, right? And that is actually 5% of global emissions. Now, 5% doesn't sound like a lot, but if that was a country, it would be the 6th largest country in the world, right? So while we're trying to save lives, we're really making the problem a lot worse. Now, it was only recently, just at the end of last year at COP28, when the World Health Organization started to advocate for climate change as a health crisis. And it became a theme of last year's COP. But that's very recent, right? So there's a lot of change here in the system to recognize climate and health together, right? Now, in countries like Kenya and other East African countries, we're also driven towards the Sustainable Development Goal 3.8 to provide universal healthcare access. But if we actually provide that kind of healthcare access the way we currently do it, which is incredibly energy intensive, transport intensive, reliable on generators to back up the unreliable grids, etc., it actually means that we're going to put more emissions out there and increase these already high emissions. So the healthcare sector really here has a responsibility actually to really transform and do things differently and break this cycle that we're in. And that's where I want to start the story of the Aga Khan University's work. So the first thing we did is actually to set a target, right? And align with a target that many in the world now talk about. It's called net zero. right? And I'm sure we've all heard about it. Net, because it's a balance, but eventually we want to get to zero. So the thing is, it's a science-based targets aligned with a 1.5-degree goal that every country in the world under the Paris Accord has signed up to. So we want to decrease our emissions before we compensate, right? And we found also, again, this is the only credible target to sign up to. Simply saying, oh, we're going to compensate or we're going to look into it in a few years is not going to be good enough for us, right? But the target also needed to be realistic enough and ambitious enough at the same time, right? If we're simply going to say, oh, we're going to do in 10 years' time, that's not ambitious enough for where we stand in the countries we work in. And because, of course, the Aga Khan Development Network agencies work in these countries that I just showed, we also really needed to outline these principles around quality of life and spurring wider change around what we do. But then where did we start from setting this carbon target, right? How do we know how bad or how good we are in what we do? So this is one of the most critical transformations I want to talk about, and I've called it sense making. So when we started to account for our carbon emissions about 4 years ago, there was no single tool available that enabled us to account for all the emissions that arise in healthcare. We would have had to train people and use 5 different tools and outputs in different formats from 5 tools. And we said, hell, that's complicated. And so we actually punched all these tools together into an Excel sheet. So again, we can send it via email when the internet or the electricity comes back, quite important in our geographies as well. Based on the latest science, we update this tool every year. And because we tested and used it around in over 700 facilities and found it really easy to use, we sent it to the World Health Organization, who's now endorsed it, and shared it with their ministries of health, countries, and many, many other organizations that are using it, right? So the outcome of using this tool is what you're seeing on the right-hand side, our kind of highest level of emissions here, right? In the green, what is called scope 1 in climate terminology are operational emissions, scope 2, that's purchased electricity, heat, and steam, and scope 3 in blue, that's everything we buy. Things we don't actually own ourselves, even, for example, flights, right, come under that, right? Everything we buy. And it's normally that in healthcare, this is the largest aspect of our emissions. But of course, we have this kind of data at a much more detailed level. So by facility and every quarter, right? Every quarter we analyze this data. And here are some of the examples of different facilities. Smaller facilities, for example, in primary healthcare on the left and larger ones on the right, they look a bit different because, for example, in larger facilities or tertiary healthcare, you need to operate them day and night, right? What has also become visible is some of the aspects that we didn't think about much before. Let's say anesthetic gases, refrigerant gases, and leaks from HVAC systems. Who would have thought that these really have a high impact, but they're really up there amongst the top emission sources? And when we further looked into it, we've said, well, what are the high energy users? Well, what is the kind of equipment that we really should be focusing on? We often think of lights, right? Even in our households, we want to replace them with LEDs. Well, it turns out most often these are actually not the highest energy users. And so we've put our money and our time and our efforts into possibly the wrong place. So again, we trained our teams to do very simple energy audits, probably not replacing official energy audits for large buildings and large facilities, but they really give indicative data. Now, what I also want to say about all this data that you've seen and a bit more that you'll see in a few moments is that for us, it's like a compass. It's not like a GPS. It's not going to tell us what exactly to do next and where exactly to go. And we've heard from other speakers in the morning how every institution, every context, every country has its own situation. But this is about a process of training people, getting data, and then moving forward. So we wanted to start identifying opportunities to make changes based on the data we have. And so when we shared this kind of data that I just showed you back with our teams, right, the energy managers, the anesthesiologists, etc., they were then able to have these aha moments and say, oh yeah, that makes sense. Now this is what we should do next. And so we collected all of these ideas and developed what we call the decarbonization plan. And it's not just a wish list. What we actually did is that we costed all of these measures. It was over 120 when we started. Now there's many more we've added. So costed them, what will it cost? But also what will it save? in terms of finances, and of course, in terms of emissions. And how quick is the payback period? And that's then how we structured these to say, okay, that's how we can implement them over time. And the types of measures that the teams came up with are really in 5 areas. For our operational emissions, obviously renewable energy, but you shouldn't really just slap solar panels on your roofs if you have very inefficient energy use. So it really needs to be complemented with energy efficiency. Third area, which often costs very little, is practice changes. How can your fleet, how can your anesthetic gases, how can your waste management become more efficient? And of course, our buildings and processes, right? So we're actually sitting in a building here that is the first green building certified with the EDGE Advanced label within the Aga Khan Development Network. And so from day one, we thought through how should this building look like? It's not an add-on to do sustainability later. And the fifth area is supplier engagement, which I'll talk about in a few moments as well. So when we costed all of these things, we also then found out, well, technology is there, right? There's immediate stuff we can do. And another myth, I suppose, in terms of technology is not ready, the second myth here is that we broke is it's too expensive. So what you're seeing on the left-hand side is the kind of cost you need to invest at day one, right? And we gave it this traffic lighting kind of signaling. But when we calculated the financial return, we actually found many having very high and very fast returns, which means decarbonization makes financial sense. And why is that? Of course, because we're spending less money on energy and other inputs. That's not commonly known, and especially not in a low-income country or medium-income country, right? And so I'm happy to say that we've made a lot of changes, even the very visible ones, such as solar panels. We have solar panels here just on our hospital right across the road, and much more is in development for this campus. Just in Karachi, our biggest campus of the Aga Khan University, we're in the process this year of installing 3.8 megawatt on our campus. So that's really massive. And the return here is about 3 years. Right? Because again, electricity is so expensive and the sun shines all the time. It's a no-brainer type of thing to do. So it's really important to kind of visualize change. And that's the next thing I want to talk about. Solar panels are incredibly visible. But some of the changes that you see here, like a practice changes, as I said, in anesthesia, again, in renewable energy, in waste management, they're not necessarily visible to the naked eye or to the untrained eye. And so through our data gathering exercise, we can actually see the dips that now exist. In energy management, which is a bit of a tilt here on the trend line, you can see it as well, right? And when we celebrate these wins with all the teams, they're much more incentivized to come up with the next round of ideas. Of course, also noting again here, all of these practice changes here were done at no cost at all, right? So they're again, this no-brainer. So this digital platform that we developed for this kind of data management is on a Power BI tool. Again, we did it in-house, and it really enabled our teams again to kind of collectively come up with these ideas. Another area that I'll briefly mention is practice or policy changes, because it's really difficult for individuals to make the right decisions. So when we, for example, eliminated single-use plastic water bottles, nearly 1 million of them each year across the university, we provided alternatives, of course, and it was uncomfortable for a few days and weeks, and people still kind of cribbed to me sometimes. But it actually showcased that when you provide the alternatives, people themselves can simply make the right decisions without having to think about it. Introducing meatless days in the cafeteria is another such one, right? That really shakes people up again and rattles them and provides examples for the things they can do even at home. Of course, the coveted electronic health record project resulted in a huge amount of paper reduction, again, for improvement of the environment. But actually, what's much less seen is the lower use of electricity, printers, toners that we have to purchase, and space for paper, right? So this is actually one of the first transformations I was thinking about talking about, which is really people, people, and people. And we've heard it sometimes today. But I thought I'd include it here at the end because it's, of course, one of the tougher ones to do. So from training people that I alluded to earlier, and it's over 100 people involved every quarter, The other change that for me in everyday life is really important is that I don't work horizontally, right? I've alluded to the various teams that I work with on a daily basis. It's a very horizontal and therefore very unusual way of working in any organization. And it's absolutely transformative when we can make that happen. So for me, creating actually a governance committee that meets regularly was one of those steps to fundamentally bring that into the system. And of course, training people from our students to our staff, and of course, partners and suppliers on a constant level has been really important to bring the topic into the fabric of the organization. Here are the pictures of training some of the students and the themes we give them every year for that. And the final transformation and maybe encouragement is for you to also for us to start thinking about some of the stuff that is really difficult. Scope 3, everything we buy is often thought of one of those completely impossible to do areas. And I just want to tell you again, start with the data. The data is how much do you spend? And I know all of your organizations know that. And what do you spend it on? You know that. These, in this case, are our cost codes. And now we know it's not IT where we want to focus. It's pharmaceuticals, medical lab equipment, and surgical supplies, right? So for us, now we know which suppliers to engage. And you can see in the bar on the right-hand side how actually through some of our engagement and of course through ESG and other kind of international processes, this has increased over the years towards the gray bar, which is our 2025 target across AKDN. So to summarize, this is not a recipe to replicate, right? This is just some of the story of how we've done it at AKU. So we set out to say that this is a transformation or a marked shift in form, nature, or appearance. So I just want to pose a few questions really quickly. Does our system still look and feel the same? Does it provide at least the same functionality and services? Do our stakeholders have new skills to understand and ideate? Do our buildings integrate sustainability from the beginning rather than afterthought? And a buzzword we've even heard sometimes today across all different kinds of sectors is resilience. Commonly, we understand it as bouncing back, like from a disaster or a turmoil. In the climate world, we actually talk about bouncing forward into a constantly evolving reality. And that's really what I hope we can do here today, tomorrow, and of course, for all of our institutions. So if you take away one thing from today, I want you to kind of think about that decarbonization is possible and it's good for business. So it's not about how expensive it is, it's how much it costs, even for human health, if we don't do it. Secondly, I really believe that climate can be a job for everyone, whether you're in IT, in HR, in marketing, we all can have climate jobs. And that is really critical for transforming, not actually mandates, but having it as a movement to transform organizational culture and opportunity. And of course, we're here at a digital conference. So with all your expertise in the room, I really look forward to some of the conversations over the coming days and hopefully weeks as well, in terms of how some of this could be linked. We're starting to do AI in our HVAC system for efficiency, for example. We're trying to not have a digital twin maybe, but think through some of this data forward to look at, well, what does it mean into the future? And I really look forward to your ideas coming out from maybe my presentation, have the conversations going forward about it. Thank you so much.